It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show today is designed to provide you with information on how to develop your own aging and care plans. Our topic today is Nursing Home Rehabilitation Service. Joining me today is Ken Van Dyck, the administrator of Atlantic Shores Nursing and Rehab Center. Welcome, Ken.
Oh, thank you.
Well, it's a real pleasure to have you on the show today, because I think that the nursing home industry, the changes we've made over the last 5 or 10 years are just really not public knowledge. I think that people, first and foremost, are afraid of thinking about going into a nursing home. And we've got to get over that mentality, because I generally refer to as assisted living care, home care, nursing home care as elements of care. And you reach a progression where normally we need some in-home help, then we need some advanced help, and we may need skilled nursing care in a nursing home. That's life. And in my conversations with Ken, folks, viewers, I sense that Ken is trying to bring a new approach to the way Atlantic Shores is doing their business up there. And I frankly am very enthused by listening to what he points out to me as what his desires are. And I think you're a little bit different, Ken, from general nursing home administrators. I sense that you have an element of care. So I put right in here that you want to do something different.
Hopefully so. You're absolutely right. The business it's a very difficult business, and it's something that really no one wants. No one wants to be in a nursing home. No one wants to be in an assisted living. No one wants long-term care, and it's quite understandable. You're living in your home, and then all of a sudden you have something that happens to you, and next thing you know, you're going into the hospital, and the next step you go from there is you go into rehab, and you get rehabilitated. But yet you find out at the very end of your rehab, when we're talking about rehab, we're talking about physical therapy, occupational therapy, and speech therapy. When you get to the end of your rehab, then you find out, well, you might not be good enough to go home, okay? So what's next for you? You have the option of living long-term care in an institutional setting such as a nursing home. And of course, that's scary for most seniors. And I would be extremely afraid of it as well. At Atlantic Shores Nursing and Rehab, we do it a little bit differently. There is many different types of modalities of therapy and treatment that we have there. And it's all individualized. It's based on the patient themselves. If unfortunately you do end up in the long-term care community at Atlantic Shores, there is going to be a completely different approach versus when people think of a nursing home, they think about, well, we're going to stay in a chair, we're going to be next to the nurse's station, and they're just going to watch us all day. Well, we have patient-centered activities that's going to hopefully maximize the stimulation of the resident, and also ensure that their life and their stay at the nursing home is going to be more pleasurable, and have the ability to work on some of the basic functions of life. We call them activities of daily living. To where it's going to enhance their living, and it's also going to enhance their potential to either graduate from a long-term care facility going into assisted living, or even going back home. That's ideally what our goal is.
But Atlantic Shores is sort of your two buildings under one roof.
Correct, yes.
You have a nursing home and you have rehab. Let's stick with the nursing home side, and then we'll shift to rehab, because
Sure.
They're sort of like two different worlds. But first, the average family finds it difficult to pay the amount of money that nursing home care requires. We somehow need to figure out a better way to provide that service to all Americans. I don't know how to do that. I really don't. I know it's needed. I know it's necessary. In the nursing home business, it's not just one size fits all.
It never is. It's got to be individualized to the resident. Patient A or resident A might have a particular service that they need on a daily basis, whether it's wound care, whether it's assistance with feeding, or even if it's a mechanicalized diet. We have to address those particular needs of the resident. Whereas another resident might be their long-term care that really unfortunate has no other place to go. They are going to require the skills of having a 24-hour on-site nurse, but can function as far as what we call function, walk, talk, feed themselves, but yet don't have the ability of taking care of themselves if they go back home without having a nurse directing their care with medication management. Or
I think many viewers are under the assumption that if you're in a nursing home, you automatically require skilled nursing service. That's true in some cases, but it's not true in other cases. Some people in a nursing home generally speaking, need assistance of some kind.
Correct. Yes.
But because of the way our country structures its Medicare system and Medicaid system, we put people in advanced care when they could probably exist in a less structured element of care. Can you talk about that for a minute?
That is 100% true. There has been times where, yes, there's people that will be in a long-term care or a nursing home facility that might be able to benefit from assisted care, where it's not going to be as intense. They're not going to have as much skilled nursing services, but yet still need the requirements of daily reminders of medication or assistance getting in and out of the bed. Now, the skilled nursing, what you're going to see is a lot of times the assistance that they need is going to be a lot more than what your traditional assisted living is going to provide. However, there is, and we've done it many times at Atlantic Shores, where we've taken a patient that has been in skilled care, long-term care, skilled nursing, and we've got them to the point, whether working with the outpatient Part B programs that we have, to be able to get them to meet the requirements, the minimum requirements of assisted living. One of the major shifts, as you touched on earlier, is yes, skilled nursing has been through a lot of changes over the last 5 to 10 years. I'm sure many would agree that are in the business that skilled nursing has kind of been a step down hospital, and assisted living has kind of turned into what long-term care nursing homes used to be, and independent living now has turned into kind of what used to be assisted living. You might have caregivers coming in on the independent living, and these were actually assisted folks. But working in both fields, assisted living, independent living, and also skilled nursing, I've seen the change over the last 10 years, and it is getting a lot more intense as far as the type of care that we're providing and the various needs. It's certainly not the assisted living or skilled nursing that it was 10 years ago.
Do you think we're making progress in the right direction?
I would like to say that we are. I feel that in the future, there's going to continue to be a very big demand for post-care after a surgery, or maybe a fracture, a hip fracture, or a stroke, and that's going to, a lot of times, is going to be taken care of within the nursing home environment, and hopefully be able to get people graduated to the point where they can go to assisted or independent or even back home. The demands of skilled nursing, I don't see slowing down. The demands of assisted living, I don't see slowing down either. And the demands of having home health and outpatient therapy, we don't see slowing down.
So it's going to increase because of not people living longer.
That's correct.
It's going to happen. But you touched on something. You mentioned stroke, surgery, but those people, when they come to your central door, they're vectored to the rehab site.
Mm-hmm.
Do you have a separate section where the people that are in rehab, they have rooms in the rehab site, or they have rooms in the nursing home site and they're given rehab services?
Yes. Both factors.
Yeah, both?
At our community at Atlantic Shores, on our rehab side, we do have long-term care patients as well. Ideally, we would want to move to a strict rehab on the rehab side, but the current population or census at our community demands that we will blend our long-term care residents with our rehab patients. Traditionally, throughout nursing homes, you would see a separation between rehab and also long-term nursing. That is correct.
So if a person suffers a stroke and they're treated at Parish Medical Center and are sent to Atlantic Shores for rehabilitation, you would put them in a rehabilitation room then?
Yes.
And then their medications, their treatment, it depends on whether they require any combination of occupational, speech, or physical therapy.
Yes, ideally, there is going to be some decreased function in occupational, speech, or physical therapy when being discharged from the hospital. A lot of times, it's the decrease of those functions which causes them to go into the hospital in the first place. So, of course, we're going to want to retrain and try to get the resident back to their previous level of function to be successful back at home. But when there is a need that comes to where that resident can't go back home, let's say that the stroke was pretty severe and they can't go back home, they can't feed themselves anymore, then that would be a person that would be moved into the longer-term care nursing side of the
and that person would go to the long-term nursing side then. When we're talking about stroke rehab and some of these other things, does Atlantic Shores, you have the in-facility occupational, physical, and speech therapy. Do you do the home aspect of it also?
Oh, yes. Yeah, we would go out and do a home evaluation. We're one of the things that I'm very happy about that we do at Atlantic Shores is therapists would actually conduct a home visit with the rehab patient that is planning on going home to make sure that they have all the safety equipment that they need within their house and to ensure that they're going to have the ability to walk up a flight of stairs if needed. We need to identify that as quick as we possibly can. If a person has a two-story house, okay, how many steps are going to be to get to the second landing? Is the bedroom going to be on the second landing? And we would want to rehab that patient to where they would be able to navigate safely through the stairs. We have stair stepping equipment within our facility, extremely the HER equipment, which will give us strength training both while resistance on both ends, whether pushing or pulling, it's going to give you resistance on both ends. And we found that that's going to increase the muscle mobility as well too. Okay.
What is your opinion on as an administrator of a nursing home and a rehabilitation center? What is your opinion on whether or not, or what advantage would a person have going from a hospital to the rehab center as opposed to going home?
Many times a person can go home. And in those particular cases, it's normally followed up with home health, which will still continue with the occupational, physical, and speech therapy if needed in the home environment. And also the nursing component that there is with home health. A patient will be evaluated when they're in the hospital setting, and the determination will be made by the caregivers within the hospital as to whether or not the person can go home safely. If they're able to go home safely, then so be it. Fantastic for them. Let's make sure that they get the appropriate therapy that they need from the hospital standpoint. If they need rehab, come into the rehab facility and identify what those particular needs are.
I'm baiting you. I don't know if you know that. I'm baiting you because
I'm waiting for it.
See, I had a stroke.
Okay.
And I went to a rehab center. And I'm thankful that I did go to the rehab center. I might have experienced the outcome that I did having gone to a major rehab center if I'd have gone home. But looking back, I don't think I would have. I'm of the opinion that more doctors need to listen to what their training is as to what the family members want. family members want the person to come home. But that 15-day stay in a good rehab center provides the patient with care you cannot give at home. It just can't do it, Ken. I had my hip replaced. I went home. I was younger. I was in good physical condition at the time. When I had my stroke, I was 80 years old. And so it made my family take a different look at the kind of service I might need. And I strongly recommend that people take a hard look at better use, more use, or maximized use of the services of the rehab centers. They're well worth it. Now, people coming out of a hospital, if you're 65 or older, are on Medicare. So that rehab stay is paid for by the government.
That's right, 100%.
Why not go to a rehab center and get the best care that you can, closely monitored? I can think of my conversations with my doctors in the rehab center regarding medications, the way I felt, what risks should I think about having experienced a hemorrhagic stroke? What should I be looking for in the future? I don't think you get those same things at home.
Right. And you're absolutely correct. Though you could have potentially been very successful had you got home health, the difference is the level of intensity. And in a skilled rehab facility, you're going to get it 6, maybe 7 days a week of therapy. With home health, you're going to get 3 tops with therapy. Yes. So the curve as far as being able to get back to your normal or your previous level of function is going to be attainable maybe in a quicker environment in a rehab facility versus going home in certain circumstances.
Okay. We've thrown the words out: occupational therapy, speech therapy, and physical therapy. Please explain a little bit more to our viewers what is entailed in, let's start with speech therapy, and why it's so important. It's not just the ability to form good words with correct diction, but it involves other aspects which then impact on occupational therapy, which is all underwritten by the physical therapy. How does all that work?
Right. Speech therapy, let's take stroke for an example. A lot of times there might be some difficulty with swallowing, okay? And there's so many different techniques that we could utilize as far as ensuring that that the resident is able to swallow again. They don't want to go back to a mechanical diet or even a parade diet, okay? If you want to get back to a normal diet, it's going to be very important to ensure that your muscles within your throat area is going to be able to be strong enough to be able to allow you to swallow accordingly. Now, there's many different techniques that we have out there. Some of them we use electronic stimulation or E-stim. And basically what it does is it gives minor electrical type of stimulation to the muscles within the throat, which simulate the swallowing activity. We found that this could increase the frequency or how fast a person is able to recover. Now, occupational, we're talking about like ADLs, your average daily living functions. Okay, being able to take the spoon from and be able to eat and bring it up to your mouth. Okay, there's certain items that we could use in order to retrain you there. There's weighted utensils that we could utilize and get you into the habit of doing that. If you're going home and if your wife is requiring you to do the laundry, of course we could work on that as well too, and that's part of the activities of daily living. And on the physical therapy side, that's when we're basically reintroducing strength. Let's train those muscles again to get them strong enough to be able to handle either support getting in and out of the chair or being able to allow you to have the maximum amount of function that you can while you're at home. Yeah. So physical is strength. Occupational is daily living, and speech is basically either talking or swallowing.
Yep. But the occupational therapy has to do a lot with enable your movements to be more dexterous, where you can, and if you take, say, say if you're going to take something out of the microwave and turn around and walk the other side of the kitchen, it's a lot safer to take it out of the microwave, set it down on the counter, move or take it there, maybe move it to another counter instead of trying to walk before you know that you're really stable enough to do that. I think we push the envelope when we go to in-home therapy too quickly. And I think that the ability to actually, physical therapy in a rehab center forces, causes, makes a person challenge themselves. I used to watch other patients when I was going through my own rehab. I would watch other patients encourage somebody that simply could not get from a chair up, or they were on the parallel type bars and they couldn't move. But by virtue of the fact that that person who was having a difficult time knew that that person there with him was having the same problem, it was like a mutual admiration society which helped each other.
Absolutely.
You don't get that but once you go to the facility therapy, then that physical therapist comes to the home and makes sure the home is safe, make sure that you can do the things you have to do.
That's correct. Yeah.
What else does Atlantic Shores, how do you differ from, say, another rehabilitation or a nursing home? You're the administrator. What are you doing there to make Atlantic Shores different?
Well, when you're visiting our community, you're always going to have the opportunity to meet me. And I always give a business card as well, too. And on that business card has got my cell phone number. I make myself available to the residents, the family members, and everyone that enters that facility on a 24-hour basis. Is that typical? We should all be doing it, but it's something I take extremely passionately. One of the things that I say when I'm touring a family or talking with a resident is, I'd much rather you be mad at me at 2 o'clock in the morning than you having to stew about it until 9 o'clock in the morning when I get there. I said, it's a lot easier for me to put out smoke than it is fire, right? I could smother the smoke immediately. But at 9 o'clock in the morning, I'm going to have a fire because not only have you lost your sleep, and the problems still persist, it's going to be a lot more difficult to address. It's going to be a lot more difficult to address the resident or the family member at 9 o'clock in the morning versus 2 o'clock. So why not just do it? If you make yourself available, to me, it's been a lot easier for us to get the customer service outcomes that we have at the facility.
I had come in the Navy's retirement home, my last job in the Navy. And once a month I have what we call an all hands meeting. And we could, in our dining hall, we could accommodate 900 people. 900.
Wow.
I'm sorry. 450. And I would get them all in the dining area. And I'd make some introductory remarks and I'd throw the floor open and I'd ask them, what are their complaints? What are their gripes? What are we not doing right? Do you ever have meetings like that with your residents?
Not necessarily with the residents. We do that with our staff. A lot of times what we're going to find is our staff members will be able to, if there's an appropriate level of communication, if they feel that comfortable talking to the administrator or their immediate supervisor, that we could resolve the majority of the issues that are there. By having an open communication with the employees, just because I'm the administrator of the facility doesn't necessarily mean I'm the most important person there. The most important person that's going to be there is a person that's spending 90% of their time with the resident. It's the CNAs, it's the nurses, it's the housekeeping staff, it's the dietary staff. They're the frontline staff members that are out there making sure that the residents have the best possible experience that they can. And if they don't feel comfortable as far as being able to communicate with me, I'm not going to be able to get the best ideas from the floor. Sure, I could ask a person to do something a particular way, but if I'm not on the floor, I don't know if it's going to be the most effective. I'd much rather get the suggestion or solution from the floor versus myself. When we talk with our residents, we have something that's called a guardian angel program, where the directors within the facility are assigned to a certain amount of rooms. We go in and we introduce ourselves to the residents, and that's how we communicate with our residents.
See, that's different.
Right.
How many nursing homes do that?
It has been a program that's been around for a while. As far as the full effectiveness, I could only account for ours.
every time I hear you mention something about Atlantic Shores, I sense there's some different things happening, but I suspect that it's your hand that's causing some of these things to be implemented, and that's because you exhibit a much wider knowledge of the needs of senior citizens. And that's not something you always find in an administrator of a home. And I'm certain, Ken, you know exactly what I'm talking about.
Humbly, I must say, it's very nice that you would say something like that, but humbly, I must say, I'm only as effective as the employees that work for me.
Well, now you're a partner with us in improving elder care in Brevard County. You're a member of our Helping Seniors organization, and I look forward to having you back on more TV shows, more radio. Well, we didn't have you on a radio show yet, but we will do that. We're almost out of time, but what would be your last thought you would want to say about Atlantic Shores and your work there, Ken?
When you need a nursing home or a rehab facility, what I would certainly do is make sure that you tour as many places as you can. Many times we're going to be the best that you're going to see, and many times we might not be. A lot of times people will look at a nursing home as far as location, but really go into the facility, take a look at it, talk with the people. Do you have the availability of talking with staff members? Do you have availability of talking with the administrator?
We're out of time, and thank you for being here, and thank you, viewer, for watching.